The next question, since we're on specific ailments, is obsessive compulsive disorder. Now, I don't know how common that is, but I have a lot of patients who tell me I have OCD. And I have physicians who tell me I have OCD. Now, I look at my office, which is piled high, both at home and in my practice of medicine, which is cluttered with everything. And I'm certainly not a germaphobe, but there are people who manage to file everything immediately, and on their desks look better than this. There isn't a single object. So I went into one of my colleagues' offices and I said, I have never seen anyone so neat. And the doctor said, I have OCD. What is OCD?
Okay. So I want to preface it by saying that speaking of personality disorders, in addition to full-blown OCD, there is an obsessive-compulsive personality disorder.
Okay.
And I don't know how you get through medical school and practice medicine without having some aspects of that.
That's true. I agree with that.
The only profession worse is probably accountants.
Accountants. Very good. This is good for tax time. So those of you who are out there who are accountants, you may have an obsessive-compulsive personality.
So an obsessive-compulsive personality, and again, we don't give the diagnosis unless they have enough of the symptoms of it and it's really getting in the way of their life. But typically, that would include symptoms like what you're describing. We don't use CDs anymore, but back in the day, the CDs or the albums would be in exact alphabetical order.
Yes.
And everything had to be put back immediately.
Yes.
And the person might be distressed if you didn't or put it in the wrong spot.
Everybody remembers Howard Hughes, who did not touch anything without washing his hands 20 times. And I have patients that do that.
Yeah, well, that I think is more OCD.
Yeah.
So the obsessive-compulsive personality disorder is like the doctor you're referring to, where the desk is immaculate and everything in its place, etc. Clothing have to be immaculate. And OCD is characterized by having either severe obsessions, obsessive thoughts, and or compulsive behaviors. Some people can't go to sleep without, let's say, walking around the bed 5 times. They have the ritual they have to do. Or they have checking behaviors, like they can't leave the house without making sure it's locked half a dozen times. They check back, burners are off.